Well, my friends, this is another successful case of a boy, age about 9 years. Age about 9 years. This boy was brought to me from the Bangladesh for asthmatic troubles from 3 years of his life. 3 বছর বয়স থেকে আরম্ভ হয়েছিল আর 6 বছর ধরে শ্বাসকষ্ট চলছিল, কিছুতেই ইমপ্রুভ হচ্ছিল না। বাট অনলি বাই দি সিঙ্গল প্রেসক্রিপশন ক্যালকেরিয়া কাপ ফর অনলি ওয়ান টাইম গিভেন মেডিসিনস ফর 4 months টোটালি কিওর। Is it not a surprising news? Is it not a surprising fact? Is it called the homeopathy is slow acting? Is it called the homeopathy is only placebo effect? পুরো ভালো আছে বাচ্চা? So only calcarea cup. Well, my friends, you must know the art of prescribing, and as also you must know the knowledge about the diseases for management and better prognosis of cases. That's why I do like to publish one handbook of practice of medicine for the junior homeopathic physicians. Asthma. Asthma is a chronic inflammatory disorder. What is asthma? For general persons, I do like to say asthma is the chronic inflammatory disorder of the airways characterized by chronic airway inflammation and obstruction. এত গন্ডগোল হচ্ছে কেন? Chronic inflammation is associated with airway hyperresponsiveness that leads to recurrent episodes of wheezing, difficult to breathing, chest tightness, and coughing. It is due to reversible narrowing of the airways. The restriction of the airway is not permanent, it is temporary. But the episodes are usually aggravated at night and in the early parts of the morning. So asthma may be different type. This child suffered from bronchial asthma. It may be bronchial asthma. Bronchial asthma is characterized by paroxysm of breathlessness with tight sensation of the chest and wheezing respiration, and with viscid bronchial mucus secretion. Well, my friends, there is other type of asthma which is known as cardiac asthma. What is cardiac asthma? When mild exertion causes severe breathlessness. সামান্য একটু চলাফেরা করলেই যদি হাঁপিয়ে পড়ে, অন্য সময় নয়। ব্রঙ্কিয়াল অ্যাজমা যে কোনো সময় হতে পারে, বিশেষ করে টাইমে, রাত্রেবেলা হয়, ভোরের দিকে হয়, সকালের দিকে হয়। কিন্তু কার্ডিয়াক অ্যাজমা কাকে বলবো? যখন রোগী একটু হাঁটতে গেলে আর পাচ্ছে না। প্যালপিটেশন অ্যান্ড ব্রেথলেসনেস অন স্লাইটেস্ট এক্সারশন is cardiac asthma. What is the cause of cardiac asthma? It is due to heart failure. It is due to pulmonary congestion. This is due to build-up of fluid in the lungs, which impairs the ability to supply the oxygen to the lungs in lesser quantity. Another type of asthma, not written in the practice of medicine, but I may say I have observed, which is neither bronchial asthma nor cardiac asthma, but allergic asthma. What is allergic asthma? The asthma is caused due to some allergens. Here IgE, immunoglobulin E, is increased to encounter the allergens. অ্যালার্জেনকে প্রতিরোধ করার জন্যে শরীরের যে ইমিউন পাওয়ার IgE, immunoglobulin E বেড়ে যায়। So allergic rhinitis and eczema are often present in such patients. তাদের মধ্যে eczema থাকতে পারে এবং অ্যালার্জিক রাইনাইটিস থাকতে পারে। And the allergens may be tobacco in any form, in any way, household dust, পেইন্ট ফিউজ রঙের কারখানার পাশে বাড়ি হলে থাকলে, পোলেন্স গাছের পরাগ, হাউস ডাস্ট, হাউস মাইটস, etc. Now, the cardiac asthma and bronchial asthma may sometimes severe. Allergic asthma never becomes severe. Bronchial asthma or cardiac asthma sometimes very severe and persistent attack in many times in a day. Sometimes continuing for many hours or even 3-4 days together. The patient become exhausted and demoralized due to lack of sleep, due to lack of physical efforts of breathing. They may be cyanosed with profuse sweating and painful distress respiration. A rapid pulse rate. Sometimes the pressure becomes low, the blood pressure becomes low, and which can lead to mental confusion. রোগী ভুল বকতে পারে, উল্টোপাল্টা বকতে পারে due to lack of oxygen supply, or even the patient may come to in a coma stage. This stage is known as status asthmaticus. Status asthmaticus, it is better to immediately hospitalize such patients. However, the child is cured, my friend, by only single medicine, calcaria card. So it is a remarkable case in homeopathy. A new feather has been added into the crown of the homeopathic success. Previously, it was used the inhaler, gas dito to pry, and for last few months, no inhalation was required. Lageni, আর একবারও লাগেনি, লেগেছে বাচ্চা, লাগেনি. This is possible only by the homeopathic medicines, calcaria carbonica. So once again, may I appeal to our junior homeopathic physicians to prescribe, to think, to rationally and judiciously by taking properly the case, present complaints, past history, family history, personal history, homeopathic general symptoms, mental general and physical general. Mental general are of different kinds of symptoms, and physical general is deject, aversion, thirst, sweat, appetite, sleep, dreams, thermal reaction, gas is cold very easily or not, hemorrhagic diathesis or not, healing of wound quick or not, and above all, the physician's own tact and talent, the interpretation of the patient, the assessment of the patient by the physician. So the interpretation by the physician and the assessment of the physician is very, very essential to a homeopathic physician, my friends.